Thank you to anyone watching this video, but an extra special thank you to my top level Patreon supporters. Thank you and thanks buddy Alan Liu, Stuart Hetherington, Mona Swearingen, and Matthew Gray. Thank you and thanks buddy.
Hey there, my name is Jason. I'm a registered polysomnographic technologist, or a sleep tech. And before I continue on with this we're going to be talking about COVID-19 as well as how it affects CPAP, Bilevel, and ventilator use either at home or in the hospital.
Can you get information about CPAP and CV-19? It's mechanical respiration. Can it be used in the ventilation of CV-19? Are we more susceptible to CV-19, or even how CPAP machine users will fare with the virus? Are we more susceptible to pneumonia if we contract a virus? Will this work for the lungs if you have CV-19?
Please take everything I say right now with a grain of salt. Do your own research, find out from actual medical professionals how this stuff relates to you. Speak with your own provider, your own personal physician, and any specialists in the field. Now, I do have a friend that I did speak with about some of this who is a medical doctor, and he also is an infectious disease specialist. So some of this I feel fairly comfortable sharing, but again, just keep in mind, I am no longer working in a sleep lab because all of our labs have been shut down. Instead, I am now guarding, I'm not kidding you, I'm guarding locked doors. I'm guarding locked doors. The second the doors lock, I'm there to guard them. And then when they unlock them, I leave. Oh my God, it's crazy. Okay, let's get into this. So with COVID-19, what we're noticing is that there's a high percentage of people per 100 people, 14% of those are being admitted and they require hospitalization. And of those, 5% are ending up in the ICU, the intensive care unit, and ventilators are heavily being used. So some of this I want to talk about how it pertains to just a typical CPAP user or a Bilevel user at home, and maybe someone who uses even more extensive or more serious non-invasive ventilation. We'll get into a little bit of that later. So a lot of what people are kind of freaked out about is that it really seems to complicate it more than anything else is the severe pneumonia that comes along with it. And with that, a lot of people are requiring the use of ventilators. Now, you've heard all about this stuff in the news, how we're going to run out of ventilators and what we're going to do with the ventilators, and people require them at home. How are we going to be able to tweak our CPAP machines into ventilators, and can hospitals do this? And what are all the ways that we can actually maximize ventilator use in the population, be it in the hospital or at home? And I'll be honest with you, I really don't have the answer to any of those questions. Here's the one thing that we do know. Hospitals are, this is no secret either, hospitals are great sources to transmit virus and infection amongst everyone that enters them. I know hospitals are supposed to be a place of healing, but more people get sick in a hospital than not. It's incredible. No matter what processes you put in place, there's just sick people there. So this gets us into, why do you want to get people out of the hospital and into home care? Well, for that one reason only. It's going to be safer. You're going to have a cleaner environment at home. You're going to be isolated. And so if you can stay at home, you definitely want to stay at home. But what happens if you require more extensive care? That I really don't know. But this is where the do-it-yourselfers, the people that are hacking, are coming in. And what about a worst case scenario? The absolutely worst case scenario. Now, I don't know how to hack these machines. I don't know if ResMed or Respironics are ever going to put anything out of how to turn these, or even if you can turn these into full-on ventilators. But they're a little more complicated than we're giving them credit for. Now, please understand that I know I joke around all the time about respiratory therapists being complete idiots and stuff like that. PhDs being idiots. I 100% joking about that stuff. It's all part of the shtick, if you want to call it that. But respiratory therapists in this particular situation are absolutely vital. If someone is in a hospital and being hospitalized for pneumonia and they actually require a ventilator, you damn well sure you want to have a respiratory therapist on your side monitoring you, because these machines do require little tweaks throughout the day as a person requires it. A lot of them aren't as automated as you think. Just keep that in mind. Let's go ahead and give a respiratory therapist a hug. God, one of my best friends is a respiratory therapist. Okay, let's just pretend you're at home and you're just a typical CPAP or Bilevel user. You're not suspected of having COVID-19. You have no diagnosis. You have no symptoms of it. Yeah, continue using your CPAP and your Bilevel. If you feel like you have any symptoms of that, but you're still feeling okay, I would definitely consider isolating yourself to a different room, and keep this also in mind. Now, we found this out with SARS during, I think it was 2003, that people with SARS that use CPAP Bilevel, it was aerosolized. So every time you breathe in and breathe out, that's shooting out the virus into the room. So you definitely want to keep that in mind. You want to be in a different room, and you may even, if you have the symptoms, want to possibly consider discontinuing use. Again, talk to your own provider about this. Don't just stop because some dude on YouTube said so. But keep it in mind that it is proven to aerosolize viruses and spread disease that way. Let's talk a second about why ventilators are even needed. So really, use of ventilators is just trying to treat the problem. It's trying to treat a symptom of the pneumonia. And pneumonia, if you're not really aware of it, pretend like this is your lung. It's all folded up nicely. Looks like a bunch of little miniature broccoli in there. You have a bunch of little sacs, but more or less, just consider it like this. It's folded up, and all this surface area in here, if you were to open it up and take a bunch of this and just cover it in oil, now that part of your lung is no longer used because the entire purpose of your lung is for a gas exchange. So the whole point of it, every time you breathe in, oxygen goes in, CO2 comes out when you exhale, and that's how gas is exchanged. Now with pneumonia, you're gonna have a bunch of mucus, and the mucus gets all in the alveoli, and it prevents you from having functional lung. So with a ventilator, the whole point of it is try to eke out as much possible usable area that you possibly can out of any lung that's actually still available. So I don't know what the percentage would be like, but obviously if you get to 100%, you're gonna croak. It's probably much lower than that because at some point the no gas exchange equals you're pretty much not breathing. And I think we can all agree that that outcome is not gonna be good. So if you couple a ventilator along with oxygen therapy, you're gonna have a better outcome. You're gonna get at least the most bang for your buck out of that. Now this kind of brings us to the topic of ventilators. Now how are ventilators in the hospital any different than like a ventilator at home if someone has a ventilator at home? Well, usually if you have a ventilator, like a true ventilator in a hospital setting, you have all kinds of breathing tubes going down your throat. So the use of a traditional ventilator like in a hospital setting is okay. You're not gonna have that aerosolized virus all over the place because you have these breathing tubes. Every time you breathe in, like obviously you're just breathing in, but when you breathe out, it's going through filters and you're basically capturing any virus that would be in the air. So it's clean. It's almost like those, what do they call it? It's clean. It's like basically it's like having some kind of a filter on the exhaust of a car that cleans it before it comes out. There's none of those pollutants get out into the environment. So now there's some different options as well. For home use, there are people that are on what's called a non-invasive ventilator. And so you have AVAPs and you have IVAPs. Now those are trade names of different types of non-invasive ventilator. So one is like BiPAP. BiPAP is a Respironics trade name. AVAPs is also a Respironics trade name. And it stands for Average Volume Assured Pressure Support. Then you have IVAPs, which is a ResMed product, and it stands for Intelligent Volume Assured Pressure Support. So of these, if you see them, sometimes they're not called IVAPs or AVAPs. Sometimes it's like a Bilevel ST-A for automatic, or you'll see like VPAP ST-A for automatic, and then the ST is for spontaneous timed. So it gives you the option of breathing, like you can trigger your own breath, but if not, there's that timed backup rate. And instead of you inhaling based on how much you want to inhale, if you're on like an IVAPS or an AVAPS, it's like, oh hell no, you're getting that volume that we say you should be getting based on your height and weight and gender. So anytime you inhale, it's like, it's go time, baby, and it's just like, pah, and it nails you. So that's kind of where it's considered a ventilator. But consider, it's always positive air pressure regardless, whereas a ventilator is not. And of the two, like if shit actually really hits the fan, the IVAP seems to be a better machine through an independent study using a Hans Rudolph breathing machine. I'm going to link that study down below, but basically the IVAPS has a trigger setting, and so you can toggle between like low, medium, and high triggering for more sensitivity or less. But it actually seemed to really make a difference of missed breaths. And then also for you do-it-yourselfers, there's a lot of people trying to hack into these CPAP machines. The FDA, and I know the FDA freaking swings and misses more often than not, they're actually now providing guidance to hospitals on how to modify CPAP, Bilevel, and ventilators just so long as they capture all expired air. And again, I'm going to provide that link down in the description box as well. So I suppose what I'm trying to say in all this is the ventilator is just the tool that we have. It coupled with oxygen, we're trying to eke out as much as we can out of your lung. Whatever good tissue is left over of your lung, just trying to get the most bang for your buck out of it. I mean, if the disease progresses enough that enough of your lung is compromised, then there's really not much you can do about it. If there is a magical way you could take the lung out of the body, clean it, put it back in, I mean, that would definitely be a way to go. But the lungs are actually really not good about getting crap out of there. That's why smokers have smoker's lung. It's not real good about getting tar and stuff out of there. So all that mucus, it takes a long time. If you've ever had pneumonia, I've had it twice. It takes a really long time to get that crap out of there. It's really uncomfortable. Every time you lay down, you feel like you're gonna die. It's actually one of the worst things ever, and having it twice was friggin' awful. So I think that's really all I have to say about COVID-19 CPAP bilevel ventilators. Bottom line is, if you're using any of these around loved ones and you know that you have it, just know that you're aerosolizing it every time you exhale if you're not on a traditional ventilator. You're gonna be blowing that crap all over the place. So please isolate yourself. Please quarantine yourself away from your loved ones. Wash your hands, don't touch your face, keep away from people. Just make do. Just try to weather the storm as much as you can. It honestly breaks my heart when I hear that family members have passed away just because of stuff like this. I mean, it seems like it's so preventable, and horrible time that we're in right now. Please stay safe. I hope you guys are all happy and healthy as much as you can be, and I'm very much hoping that things can get back to normal. And if you haven't yet, please subscribe to the channel. And I understand the tone of this video is very different from any other video I've ever done. I'm gonna get back to the normal stuff here actually this week. Again, stay safe.
Amazon purchases are at an all-time high, so please consider using my Amazon affiliate link down in the description box below. If you don't know how to find it, it's down in the description box below. Click show more, and there it is. Click that link, and as an Amazon affiliate, I earn on all qualified purchases. Now, the other day, my wife was home alone, got a little freaked out. Some people across the park decided to come onto our lawn and pee in my bush. Now, no one pees in my bush without being recorded. That didn't sound right. But I wanted a security system, got a security system. Nice. You can use my Amazon affiliate link for anything. Just know that whatever you buy, anything at all, I earn on all qualified purchases. Now, I haven't caught those pesky pot-smoking kids, but I did catch a neighborhood cat that's been kind of terrorizing my house. He urinates in my garage, he eats my cat's food. I call him DC. It really stands for Dick Cat, but when my kids ask, I say it stands for Dad Cat.